what are the symptoms. All these things we should understand, because that is how we are going to get educated. So once we know this is for example autism spectrum disorder, the diagnosis given. So we need to know what is autism, we need to know what are the characteristics, we need to know what are the interventions, we need to know what are the resources available. We also need to know what are the resources, what are the parent organizations available, because we can make that parent or that family to get in touch with those associations also. Then dealing with societal attitudes, stigma, discrimination, advocacy, skills. So stigma and discrimination we all know, we have discussed that. Advocacy skills are there because we need the family to advocate for their rights. Family doesn't mean parents, father and mother, it also means all other who are involved with that child or with that person. So for that only we need to have the advocacy skills. Madam, you can say here or comfortable? Then managing emotional stress. See, caregiving stress is very much there. It's caregiving everywhere. If you see, caregiving stress are the most thing where parents come and say, mothers come and say, I'm unable to manage. It's because it is very difficult. If you have a child in the family, it is very difficult. Just imagine how the condition of the person. I'm not talking only about child with disabilities. I am talking also about any person in the family getting sick, maybe due to cancer or maybe due to some other illness, and the amount of caregiving or caretaking we have to give. So it puts stress on each of us. So overcoming that stress, managing emotional stress, caregiver stress, that is the burnout, exhaustion, everything we have to manage. Similarly, self-care. It is important for both individuals and the families of persons with disabilities to manage self-care. So the role of family-centered intervention is that. Peer support. See, whenever there is a good event happening in the family, we all will be very excited to share the pictures, the photographs, or event with others. But if there is something bad happening in the family, we restrict ourselves to share it with others, because thinking that what people will think, or people will think that something is happening in the family and this fellow is posting everything in the Facebook. Nowadays, all this information, how we'll know? Suppose one of our friend passed away yesterday night at Atlanta, USA, due to heart attack. We didn't know that, so we came to know only through Facebook. That's so and so things happen. So, in one way, it is very informative for us to know that something has happened. Other ways, people take in other angles also. So that is their own thing. So peer support is important. So that's how we will get peer support. If we don't have peer support, any of us doesn't have any peer support, it is very difficult to survive in the society. We all feel lonely, we all get isolated, we all get aloof. Next one. Then building resilience. So we need to have a positive outlook wherein we try to make the families understand their strengths, their capacities, their capabilities, so that they come up from being a very difficult situation to a very positive situation. Coping. Goal setting. Some of the goals we can set so that can boost the family's motivation, self-esteem. These are the two things. Navigating transitions. Transitions in life. See, transitions in life, all of us know it is very important. We move from birth to small, let's say pre or early childhood education. Then we go on to the school age. Then we go on to the secondary age. Then we go on to the pre-vocational age, vocational. Then ultimately we try to earn. Then we have an independent life. So all these things are transitions. So wherever the transition is happening, there will be a lot of stress for the people with disabilities also, and for the families who are helping or who are there with the disabilities. So we need to focus on transitions. So how to positively navigate the transitions. That is what family-centered interventions focus. Access to mental health services. Very important to have mental health services because caregiving stress wherein you have all the depression, anxiety and everything, you need to have certain amount of services for mental health also. It is very important. As I was pointing out, caregiving stress, self-care is very important. Next one. Second one, first one was emotional support. Second one is information and education. So when we talk about information and education, we need to understand their disability. That means we need to make them, we need to provide the families with the knowledge about the specific disability. And how are we going to provide this information? We are going to provide through clear explanation of the diagnosis. We are not going to use very technical terms when we clearly explain the diagnosis to the families. We give a very comprehensive information about that specific disability. We provide resources. Whatever resources are available, whether it is through internet or through books or anything, we try to provide them with the resources. And the third one is a regular consultative meeting with the professionals, with all those stakeholders who are taking care of that person with the disability. Next one is we need to understand or learn about the services that are available. So from information education, we understood the disability, then we are learning about the services.